the sports and cartilage surgeons. Today we're going to show a unique testimonial. This is a patient that had recurrent instability of the patella and eventually was found to have a cartilage defect, and then an acute injury caused this plus tore their ACL. So this combo is pretty unusual. And what we did is kind of a staged approach. So the first part we did an ACL repair, then about 3 to 4 months later went back and finished up the patella to get him to actually have a normal knee and have less pain. So we replaced the cartilage with MACI, and then we did an MPFL reconstruction and a TTO. And again, this combination is long, a hard recovery, which we'll go through, about 16 months, but you can say he's back to hockey, he's jumping around, he's still on the road to full recovery, and again, it takes a while, but he's really happy, and again, for a lot of surgery, we had a really good result, so enjoy. Thanks.
So my name is Kyle Berquist. I play hockey, and I grew up playing hockey. I've dislocated my kneecaps many times over, but kind of thought that that was in my past, and maybe was playing a little too aggressively in the adult league and went down funny, and I thought I had just dislocated my knee again, but it was quite apparent that the next day it was more than just a regular dislocation of the kneecap. So I wasn't able to walk. I wasn't able to put pressure on it. I couldn't bend my knee without having extreme pain. It felt like it was on the verge of dislocating every time you just touched the lower part of my leg. And that's when I went back to the ER to have them take a look at it, and met Dr. Garcia, who ran some tests and took some pictures of it and said, hey, maybe we have a bigger issue here than just a normal kneecap dislocation. I remember sitting in the patient visiting room, just not knowing what's going on, except for the fact that my knee hurts really, really bad. And Garcia comes in with the images and goes, "This is my jam." And I thought, well, all right, I like this guy. And he rolled down the list and he said, you have ruptured your MPFL, your MCL is probably a bit ruptured, your LCL is a bit ruptured, we're going to have to do a lateral release, your kneecap is dislocated, your ACL has been ruptured, we're going to have to do a MACI biopsy to throw some cartilage back on there, and then we're going to have to do a TTO, which is we're going to cut the top of your tibia off and relocate your kneecap. And I just broke down crying, because that was too much at one time. But that was 16 months ago, and here I am today, having gone through all that. And yes, it was a lot, and emotionally and psychologically it was really hard sometimes, but I am back on the ice coaching both my kids playing hockey this season. So awesome. Couldn't be.
How did you feel about the explanation of the surgeries you needed?
The explanation of the surgeries I needed, I was a little bit cloudy and just kind of like, hey, you told me this is your jam, I am up for it. But you did answer every single question that I had. I did understand as much as I wanted to understand at the time. It was one of those things where it's like, I can tell it's getting better. It's very slow, but then you kind of get to this 6 weeks, or at least I did. I got to this 6 or 8 weeks, and all of a sudden I was able to start walking around. I was able to start moving. I was standing. And the second I was able to start moving on my own, without like a crutch or whatever, as soon as I was like walking on it, then it started to get better really fast. And that surgery was September 26th, and I was standing on the bench coaching my kids' team in Martin Luther King weekend. What is that, 4 months later? So it was tough, but it gets there.
So talk about how you're doing now.
How am I doing now? I can run. I go bike riding. I am out on the ice with the kids. It's there. You can still feel it for sure. Like, it doesn't feel like nothing had ever happened. But if I go back 16 months where I couldn't even walk, stand, do anything, and it felt like it was going to just fall apart if anyone even touched it, it feels amazing. And it feels like I'm on the right path moving forward. And it's just a matter of continued rehab and continued strengthening, and we'll get there. So.
And while it was tough for the 2 surgeries, do you feel like, knowing now where you're at, would you still do it?
100%.